All right, let's continue the conversation now. I have Richard Roth. He's a Democratic strategist and founder and partner of the Roth Law Firm. Also, Jennifer Kearns, contributor for the Daily Caller in the Hill. Guys, thanks so much for coming on here. Richard, I'll start with you because I didn't get to you in the first hour here. But how dangerous is it delaying the vote on this relief plan? They didn't exactly come to terms here, both sides. But with that comes this complete delay. What's your thought on that?
Yeah, I don't think it's that dangerous. The bottom line is that this is an economic issue. Right now, nobody's working, so it will eventually happen. What's happening is Steve Mnuchin is essentially playing shuttle diplomacy and going back and forth with Schumer and with McConnell and trying to essentially come up with a deal whereby they can all live with. The concern the Democrats have is they don't want just unnecessary spending to anyone by the Secretary of the Treasury, and he's going to assure the Democrats that's not going to be done. So I'm not that worried about. The bigger concern, of course, is people's health. The market's going to go down. The market's going to go down for days because we just don't have anyone working, especially in New York State. So it's what's more troubling is really the health more than the economic stimulus.
Jennifer, I'll bring you in on this. I'd like to hear your thoughts on the matter.
Well, look, that's easy to say that, a few days doesn't matter or a few weeks doesn't matter if you're not getting a check. That's easy to say if you're on the Upper West Side of Manhattan or somewhere like that and have plenty of food and plenty of savings and you can ride out the market. What's not okay is we have millions of people in the gig economy, millions of restaurant workers who are going on day 15 now. They have just surpassed their first missed pay period. And we've got to get relief to those folks out. What I would recommend they do, and Steve Mnuchin has alluded to this, that they do it in chunks. They don't have to, all come to agreement and sing kumbaya, but they need to start getting that relief out to the American people directly and get cash in people's hands so they can go buy food, they can go buy medicine, they can afford to have these telemeds. If you don't do that, and I've worked in healthcare and disaster response, if you don't do that, then what you're going to have is people panicking and going out into the streets to try to find food and going to the emergency room because they can't afford a telemed appointment. So this is critical. Time is of the essence. It has to happen now, but the reality is we'll probably won't see the first bill until probably Wednesday of this week.
Yeah, but Jennifer, that's just not going to happen. People are not going to get $5,000 sent to them to pay for medicals. They're not going to be able to pay for rent no matter what the Senate does. They're not going to be able to pay for medicals. The money that that's even being approved by the Republicans is far deficient. The problem, as I said, is the epidemic, not the finances. No one's going to walk and get a check in their mail to pay for their medicals, to pay for the groceries. The bottom line here is that the president has to take this very much more seriously than he's taking it. The Defense Production Act must be deployed. We have to get ventilators. We have to stop this virus from spreading. The Senate can't stop that.
Jennifer, your thoughts on that? Go ahead.
Well, look, Treasury Secretary Mnuchin has said people would start getting their checks as soon as next week on April 2nd, April 3rd. So that's just not true. Second of all, look, I've been no fan of President Trump. Some of his press conferences have been out of control. He did rein that in yesterday. He had a fantastic press conference. He gave specific numbers down to the individual mask numbers, the N95 masks, the gowns, the face shields, and the medicines that were on their way and had already been delivered. And those were hundreds of thousands of them to the critical states. And so I think you may have missed that, but the president and the White House is on top of this. They're giving the American people.
Jennifer, here's why they aren't. There's something called the Defense Production Act. He has to deploy it. What he's relying right now is 3 car manufacturers, 1, 2, 3, to help make ventilators. There is a significant undersupply of ventilators. If he deploys that act, he will get everyone working on it. We have it can't be more serious. I agree with the president. I agree the last press conference was better ones. We have an invisible enemy. The only way to defeat that enemy is through ventilators, defibrillators, masks. And by not deploying that act, he's going to hurt himself. I think on the polls, as far as the polls go, he's betting this is over soon. Let's not forget, in Italy, 800 people are dying a day. The U.S. is 5 times bigger than Italy. We have 320 million. They have 60 million. We very well may be facing 3,500 people dying a day. If those numbers go to what Italy is, then those polls are going to go down.
I got to jump in real quick because I don't have much time left with you guys, but really quick here, the malaria drug that we've been hearing a lot about, hydroxychloroquine, the president states and giving hope to the American people. He's chastised for it in the mainstream media. We now know Governor Andrew Cuomo is going to institute that cocktail, if you will, rather, the Z-Pack and hydroxychloroquine. My question is this, what's the difference here? The president mentions it and no one wants to hope about it. Now we're actually going to be seeing this happen on Tuesday, trials of this. Jennifer, your response.
Yeah, look, Richard, I understand the panic here, but look, the public called for the Defense Production Act to create N95 masks. Guess what? 2 companies stepped in and did that. They upped their production. And they're going to start delivering those masks immediately. And the same goes for the medication, the trial medication. They made fun of President Trump last Friday for doing this. And guess what? Starting tomorrow in New York City, you will see those cocktails being tried in New York City to save lives.
15 seconds, real quick. Richard, go ahead.
Sure. Listen, it's about ventilators, not about masks. It's about saving lives. Masks are for the hospital staff.
Absolutely.
The bottom line with the drugs,
Richard finish real quick.
It is, Jennifer, my 15 seconds. It is, he was definitely too optimistic. He's not a doctor, however. We've seen good signs. Let's pray and hope that he's right. And that, in fact, it does start saving lives, because that's the biggest fear we have right now.
All right. We appreciate both of you coming on. Ran out of time there, but always good to hear from both of you. Richard Roth, Democratic strategist and founder and partner of the Roth Law Firm, and Jennifer Kearns, contributor for the Daily Caller and The Hill. Guys, thanks so much.